Well, thank you for the question. This is a really very important question. So I think the biggest challenge is what we see right now is still that although pharmacogenetics has been a field which has been around for many years, for decades, that physicians still don't know much about it or are hesitant to actually utilize this information. And in part, that it's true that one of the reasons is that the interpretation of pharmacogenetics results and how this, is the relevance to a particular drug is mildly said a little bit complicated. If you're looking at what you need to figure out what gene you need to test, sometimes it's multiple genes which interact with a particular drug, and sometimes the increased function of a gene. For one drug, you have to reduce the dose. For another drug, you have to increase the dose. So it is complex. There are obviously a lot of drugs out there. And so the interpretation is really challenging. But I think the biggest development, and I think this is then also speaks to the future, really lies in the fact that information technology really helps now and can help physicians, and the information gets provided to physicians and presented in a way that it's not that complicated anymore. I mean, it doesn't have to be that complicated. That's in part linked to the progress and the distribution of electronic medical records, and where you can code in, and software and interpretation guidance is there, where if you have the genetic medication, the genetic information in the medical record, and you would like to prescribe a certain drug, that in the background, the software helps you with the interpretation of the results, provides recommendation, and the foundation for that is some of these examples what I showed in my presentation, the Clinical Pharmacogenetics Implementation Consortium, which develops guidelines. And so I think as electronic medical records are now widely available and utilized, and this IT support, this in the background decision support becomes more and more integrated, I think this really will take away one of these hurdles, and then physicians will have the information and the interpretation much easier available and can use that when they would like to prescribe a drug. So I think that's the next steps. What I see that is clearly happening, and the other thing what I see is that genetic analysis will become much more widely available. Physicians will recognize that, patients will actually ask for that, and so we've seen this with consumer genetic testing. Patients have an interest in this and develop an interest, will often come to now in the future, might come to a physician and say, like, you know what, I have these results, I have these genetic results, and we integrate it in a medical record, and they would like that this information gets utilized. And so with that, I think this is one of the areas where we at RPRD see a substantial potential. Not only as a clinical pharmacogenetic testing lab, but also help with the interpretation, help with the integration in a medical record, and also educate physicians about this field. I think in my presentation, I showed you the numbers that with an aging population, patients receive more and more drugs. And obviously we, benefit patients, we increase life expectancy, and that is a good thing. But managing patients with multiple drugs is a challenge. With multiple drugs show certain interactions. They interact with pharmacogenetic genes. And so with an aging population, there will be more and more patients who receive multiple drugs, where you see polypharmacy. And so I do think that in the future, because of demographics, pharmacogenetic testing, there's going to be a much more an increase in pharmacogenetic testing, increased demand in pharmacogenetic testing, and we will see also more work done in this overall area. So I think that I think is pretty clear to us, and this is why we're also focusing part of our work on patients with polypharmacy and geriatrics and patients over 65, where we think that pharmacogenetic testing can substantially improve treatment and reduce adverse drug reactions.